In this lecture, we're going to move on to the peritoneum and the peritoneal sac. So the peritoneum and the peritoneal sac, or the peritoneal cavity, is a really important serous membrane that lines the inside of the abdominal cavity, and it encloses the abdominal viscera. It allows the organs within the abdomen to move freely and smoothly. And it's also important in suspending and supporting these organs. So we're going to look at the various parts of the peritoneum and how it's divided into visceral and parietal parts. We'll look at retroperitoneal and intraperitoneal organs. And then we'll move on and look at mesenteries, peritoneal ligaments, and omenta, before finishing with the subdivisions of the peritoneal cavity, like the greater sac and the lesser sac, and how we can look at infra and supracolic compartments. So previously, in the lectures that have preceded this, we've spoken about the organs really in isolation, and we've put them into context with the relationship they have with other organs of the abdomen. But this peritoneum is the membrane that binds them all together, that attaches them to one another or attaches them to the body wall. If this peritoneum didn't happen, it didn't occur, didn't exist, then what's to stop the stomach just falling down into the pelvis? The fact that the stomach is suspended via the lesser omentum, we'll come to know, from the liver, and it holds it to the spleen, and obviously it's anchored to the esophagus and the diaphragm, gives all of these organs their position within the abdominal cavity. And that's what we're going to look at today. So let's start off with some important definitions. And there's lots of definitions that need to be described in relation to this peritoneum. So let's start off with visceral peritoneum. This is a portion of the peritoneal membrane that is tightly adhered to a viscus, so tightly adhered to, say, the small intestine. If you're familiar with the thorax, then this is the same as visceral pleura, that was tightly adhered to the lungs. So we have visceral peritoneum. And in this diagram, we can see this region around here would be visceral peritoneum that's tightly adhered to the small intestine. Parietal peritoneum, so visceral peritoneum, parietal peritoneum is what is adhered to the inside of the abdominopelvic wall. So this is the layer of peritoneum that lines the body wall, that lines the anterior abdominal wall, the lateral abdominal wall, and forms a sheet over the posterior abdominal wall. So this here is parietal peritoneum. And parietal peritoneum can actually just run over an organ. It can just run over an organ like this. And we can say this like is the kidney or the pancreas. And the parietal peritoneum just runs over the top of it. Now, visceral peritoneum and parietal peritoneum. We also have definitions to define the relationship of an organ to the peritoneum. And these can be either an intraperitoneal organ or a retroperitoneal organ. We mentioned retroperitoneal organs before when we spoke about the duodenum. That is a retroperitoneal organ, or at least the vast majority of it is. The kidney is a retroperitoneal organ. The pancreas is a retroperitoneal organ. And what I mean is by a retroperitoneal organ is that this organ is positioned between the body wall and the peritoneum. Just like in this example, we have the kidneys. Here we've got the body wall in black. So here's the body wall in black. And red is our parietal peritoneum. This organ, the kidney, is between the body wall and the peritoneum. So it's retroperitoneal. An intraperitoneal organ is an organ that is completely surrounded by the peritoneum. And we have a series of these organs like the stomach, the spleen, the small intestine, was surrounded by peritoneum. So here we could have the stomach, let's say, or the spleen. And this is where it is completely surrounded. Typically, it will be suspended via a mesentery. And here we can have a mesentery. Now, a mesentery is a double layer of peritoneum. We can imagine the parietal peritoneum coming in this direction, and the parietal peritoneum coming in this direction. And where these two converge, they then adhere and they move upwards, where they can then surround the organ. So they converge, they move upwards, and then they surround the organ. And this mesentery is really, really important, because running through the mesentery are going to be various blood vessels, are going to be nerves, going to be lymph, allowing that organ to function. But the advantage of having the mesentery is that it gives the organ mobility. It allows it to move around within the abdominal cavity. It's not restricted. And this is an intraperitoneal organ suspended by this mesentery. So that's a series of definitions to start off with. We spoke about retroperitoneal organs like the kidneys, but we also have organs which are known as being secondarily retroperitoneal. And these organs were initially intraperitoneal and suspended by a mesentery, just like we have here. So if, for example, we say this is a piece of colon, then that piece of colon is suspended from the body wall via this mesentery. And during development, the small intestine grew a lot faster and to a greater extent than the large intestine. Now, we know the position of the small intestine is right in the middle of the abdomen, and the large intestine has been pushed to one side. Now, the consequence of that massive increase in growth of the small intestine is that it actually pushed the ascending and descending colons to their lateral margins. So what happened is that originally the large intestine was all suspended by this mesentery. But as the small intestine increased in size, so it pushed the large intestine, its ascending and descending portions, to one side. It pushed it to one side so that the mesentery actually collapsed, which is what we can see here. So that actually an organ like the ascending or the descending colon started off having a mesentery, but this mesentery actually then blended with the parietal peritoneum that was on the body wall. So originally it was an intraperitoneal organ suspended with a mesentery, but during development it has assumed this retroperitoneal position, and therefore we call it secondarily retroperitoneal. It is retroperitoneal due to a different process than the kidneys or the pancreas. Other secondarily retroperitoneal organs include the duodenum as well. These organs that originally started intraperitoneal but got pushed laterally due to the expansion of the small intestine, the jejunum and the ileum. So they then blended, their mesenteries blended with the posterior abdominal wall's parietal peritoneum and became secondarily retroperitoneal. So that's another important definition. Some more definitions. Mesenteries, peritoneal ligaments, and ommenta. These are double layers of peritoneum that support and suspend the abdominal viscera. Let's just look at mesenteries first. I mentioned mesenteries in the previous slide. These are important conduits for blood vessels, nerves, and lymphatics. A real good example is the small intestine mesentery, so-called the mesentery. It's very extensive and runs only about 5 or 6 centimeters from the upper left quadrant to the lower right quadrant. And the mesentery fans out. It fans out and then its free edge attaches to the jejunum and the ileum. That gives the jejunum and the ileum great mobility to move freely. We have another one, which is the transverse mesocolon, but we could have the sigmoid mesocolon as other examples. The mesentery, though, is the most extensive, and it allows the branches of the superior mesenteric artery to run up through it to supply the small intestine with its blood, its nutrients. We also have what are known as peritoneal ligaments, and these are double layers of peritoneum again. And they specifically attach an organ to another organ or attach the organ to the body wall. For example, The liver is attached to the anterior abdominal wall via the falciform ligament, and we'll come to know more about the falciform ligament later on. The stomach is attached to the spleen via the gastro-stomach-splenic spleen ligament, the gastrosplenic ligament. So the falciform ligament is associated with the liver, and then we have the gastrosplenic, which is associated with the stomach, and the splenic, which is associated with the spleen. And these two are in communication, the gastrosplenic ligament. Again, allowing these organs to have their structure, to have their position retained within the abdomen. We also have an omentum. Now, omentum, a greater omentum and a lesser omentum, are associated with the stomach. And we've seen these before. We saw the greater omentum when it's dangling down from the stomach and then it attaches to the transverse colon. We'll look at that in the next few slides. And we've spoken about the lesser omentum before as well, connecting the lesser curvature of the stomach to the liver. So we've looked at these definitions. Now let's put them into some kind of context by looking at the actual opened abdomen and seeing what we can find. So here we have an opened abdomen. We have the peritoneal cavity has been exposed. Now, here we can see the flaps of the anterior abdominal wall. Now, lining this surface will be parietal peritoneum. Tightly associated with the organs will be visceral peritoneum. And if it's not visceral peritoneum, it's going to be parietal peritoneum running along the posterior abdominal wall. And here we have this peritoneal cavity. Essentially, it is like a balloon has been placed into the abdomen and is pushed against the walls. And these organs have protruded into it. So there's nothing actually within the peritoneal cavity except a thin serous fluid, because the organs have pushed through the peritoneum without actually piercing it, just like you've pushed your finger through a balloon. You don't actually pierce the balloon, but you go through the balloon's surface and you can project your fingers into the cavity, which is filled with air. That is the peritoneal cavity. We can divide the cavity into a greater sac and a lesser sac. And we can see the greater sac here. You open up the abdomen and the greater sac is what you see, and you can put your hand into it. If we lift up the greater omentum, like we have done in previous occasions, we lift up the greater omentum, we have a nicer view of the greater sac where we can see the small intestines again, we can see the ascending and descending colon. So we can explore the greater sac. If we flop the greater omentum down and we lift up the liver, then we can see this view, which is the stomach connected to the liver. And here we can see the lesser omentum, this membrane here. Now, if we go to what's called the free edge of this membrane, we can see we've got a little aperture here. And this is a little foramen. This is a hole. And this is the omental foramen or the epiploic foramen. And this actually allows the greater sac, which we can put our hand in, to communicate with a space that is located behind the stomach. That space is known as the lesser sac. And these two sacs are formed as the stomach rotates during development. We can see then that we can communicate the greater sac, which is around the small intestines, around the large intestine. We can communicate with the lesser sac via this omental foramen. The greater sac can be further divided into supracolic and infracolic compartments just by looking at the transverse colon. And everything below the transverse colon is infracolic, so the small intestines, ascending, descending colon. And everything above the transverse colon, the stomach and liver and spleen, is in the supracolic compartment. We'll return to these later on. If we were to do a section through the abdomen, then we'll see these peritoneal cavities, the greater and lesser sac, and the various compartments in more detail. Now, what is this rather complicated diagram on the screen? Well, this is a section, a sagittal section through the abdomen. And here we've got the vertebral column. So this is posterior. We've got the vertebral column. We've got the aorta. This is the diaphragm here, and the liver, the stomach, the transverse colon. This is just a part of small intestines. And here we've got the pancreas. Here we can see the bladder, and we've got the rectum, and this is going to be the anterior abdominal wall. Now, the peritoneum lines the anterior abdominal wall. It lines the anterior abdominal wall. So here we can see we've got parietal peritoneum, just in green here, parietal peritoneum. Now, if we were to follow that, if we were to follow it all the way up, we'd see it run over the underside of the diaphragm. We'd then importantly see it actually run down to attach to the liver. And this is an important transition between parietal peritoneum and visceral peritoneum, with the visceral peritoneum now running over the liver. We can see this piece of green is completely continuous, and we have parietal peritoneum, and we now have visceral peritoneum. The same continuous sheet, but the visceral peritoneum is over the organ, parietal peritoneum over the body wall. We can then follow that and see that it extends away from the liver to the stomach. So we can see we now have a layer that's going from the liver to the stomach. We can then follow it all the way around the stomach, and then dangling down from the stomach, we find we have this membrane, this apron-like membrane that's running down from the stomach. Once it gets inferiorly, it then runs back up, and it goes over the transverse colon towards the posterior abdominal wall, in line with the pancreas, and then it returns towards the transverse colon, surrounds it, and then runs back to the pancreas. So what we've described is the lesser omentum here. We've described the lesser omentum here. We've described the greater omentum here. Lesser omentum, the greater omentum. Remember these peritoneal structures that are suspending the liver. We can then see that running back towards the pancreas and then running towards the transverse colon, we have found the transverse mesocolon, suspending the transverse colon. We can then follow this parietal peritoneum down in this direction, and we see how we have these two layers that are along the posterior abdominal wall, and they're radiating over the small intestine. So we have parietal peritoneum, and we have visceral peritoneum. And what we've got here is the mesentery. We can now see how these mesenteries allow these organs to move around within the abdomen. Now, everything in this space here, this free space, is known as the greater sac. Is known as the greater sac. If we now look at the peritoneum that's forming this lesser sac, we can now look at it in blue. The same principles have applied, but this time we're now posterior to the stomach. We can see we have it running parietal peritoneum here over the diaphragm. It's then connecting to the liver, and then it's running over the liver here as visceral peritoneum. It then runs towards the stomach, where we've now got the lesser omentum again, running over the stomach, the underside of the stomach here, to run on the inside of the greater omentum, and then it's running up back towards the posterior abdominal wall. And all of this in here is the lesser sac, or the omental bursa. The lesser sac, or the omental bursa. And if you remember from the previous slide, these two sacs can communicate. This is the lesser omentum. This is the lesser omentum, which we can see here. Lesser omentum between the liver and the stomach. And in this slide, we can see the lesser omentum from the liver and the stomach. And we can communicate the greater sac here, greater sac, can communicate with the lesser sac via the epiploic foramen, or the omental foramen. And that's just going to be a little aperture here that allows us to communicate from the greater sac to the lesser sac. Greater sac towards the lesser sac. We can also pick up some other important peritoneal ligaments. Remember, a peritoneal ligament is a double layer. We've got a layer here and a layer here. And this, importantly, is our coronary ligament. And we'll look at that in more detail when we'll come to the liver. So we can see we've got a whole series of greater omentum, lesser omentum. We've got the greater sac, we've got the lesser sac, and we can see we'll be able to develop the idea of peritoneal ligaments. The final part I want to do just on this section is looking at the greater sac again and this supracolic and infracolic compartments. This is relatively straightforward. All you have to do is just lift out the transverse mesocolon and the greater omentum and form this kind of separation in this kind of direction. Everything down here is the infracolic compartment and everything above is the supracolic compartment. So we can see that in the infracolic compartment, we've got the colon, we've got the small intestines. And in the supracolic compartment, we've got the stomach, we've got the liver, for example. Just different regions of the abdomen within this greater sac. Okay, let's explore the lesser sac in a little bit more detail. Here we can see the liver and we can see the stomach. And we can see the membrane between the liver and the stomach, the lesser omentum. So here we can see the lesser omentum running here. Remember, the lesser omentum, it's free edge, epiploic foramen, allowing the greater sac and the lesser sac to communicate. If we were to look at the boundaries of the lesser sac, then to do that, we've opened up this lesser omentum here, and we can see posteriorly, we have this organ, which is the pancreas. Now, if you're standing on the pancreas and you're looking forwards, the anterior boundary is going to be the stomach and the lesser omentum, obviously. You've got the pancreas behind you, you've got the stomach in front of you. So the anterior and posterior boundaries are those two. Laterally, so over in this direction, we've got the spleen. We're in the lesser sac here now, with the stomach being lifted up. So anteriorly, it's been removed to see into the lesser sac. Posteriorly, we've got the pancreas. Laterally, we've got the spleen over here. And then medially, we've got the caudate lobe of the liver. And these are the boundaries of the lesser sac. Remember, the lesser sac can communicate with the greater sac via the epiploic foramen. Let's concentrate on the lesser omentum. The lesser omentum, this double layer of peritoneum, extending from the lesser curvature of the stomach to the liver. It also extends from this first bit of the first part of the duodenum. So we can see that the lesser omentum extends lesser curvature of the stomach and the first bit of this first part of the duodenum. So it's extending here and it's going to the liver. And that's the lesser omentum. Because it's coming from the stomach and duodenum to the liver, it's got two peritoneal ligaments within it. The lesser omentum can be divided into two peritoneal ligaments. The hepatogastric ligament, liver-stomach connection. So this bit here, this will be your hepatogastric ligament. And the remaining part that's going from the liver to the duodenum, so this portion here, is the hepatoduodenal ligament. The hepatoduodenal ligament is really important. It contains what's known as the portal triad. These are three structures, portal triad, that pass towards and from the liver. It contains the hepatic portal vein, taking venous blood from the GI tract to the liver. It contains the hepatic artery, providing the liver with oxygen and nutrient-rich blood for it to function. It also contains the bile duct, which is bile produced from the liver, a way for it to pass into the duodenum. So three structures. Deep to it, this is the hepatoduodenal ligament, and then we can see the omental foramen again, this little aperture just underneath. That communicates, as I've said, the lesser and greater sacs. If you were to insert a finger in this foramen, then it would have four boundaries. If your finger's in this foramen, then posteriorly, you'd find your inferior vena cava. Anteriorly, you'd find your hepatoduodenal ligament and the portal triad. Superiorly, you'd have the caudate lobe of your liver. And inferiorly, you would have your duodenum, the first part of the duodenum. With your finger communicating between the greater and lesser sacs, they're the boundaries of the epiploic or the omental foramen. The greater omentum. The greater omentum is this apron-like structure that I've spoken about. Here we can see it hanging down from the stomach and then running back up towards the transverse colon. This is the greater omentum, this apron-like structure. It's pretty fatty, and it's really important because it actually prevents the visceral peritoneum that's adhering around the organs from attaching to the parietal peritoneum of the abdominal wall. So it forms a nice kind of apron-like boundary. It's incredibly mobile, and it's an important function, and it's sometimes referred to as the policeman of the abdomen, as it can surround an inflamed organ. If an organ becomes inflamed, then it can become quite sticky with fibrin. And then these parts can actually stick together and you can have what are known as adhesions. The greater omentum can actually migrate to this area and it can kind of close it off, and it can limit the inflammation and therefore limit the spread of these adhesions. So the greater omentum is really, really quite important. The greater omentum, like the lesser omentum, can be split into three parts. Three peritoneal ligaments make up the greater omentum. And it's relatively straightforward. The ligament is named after the two organs that it runs between. So the gastrocolic ligament. The gastrocolic ligament is running from the stomach to the transverse colon. So all of this bit here is known as the gastrocolic ligament. Difficult to see on these diagrams, but an extension towards the left, the greater omentum extended from the stomach to the spleen, gastrosplenic ligament. It can then extend all the way up and pass from the stomach to the diaphragm, gastrophrenic ligament. So gastrocolic is this main visible part here, gastrosplenic, stomach to spleen, gastrophrenic, stomach to the diaphragm. So the greater sac. We've explored the greater sac in a bit of detail beforehand, but it has some important aspects because fluid, if it builds up in the peritoneal cavity, can communicate freely around the greater sac. And we can see that here if we look at the supra and infracolic compartments. So here we've got the greater sac, and we've got its transverse, ascending, and the descending colon here, and the small intestines in between. And everything that's underneath this transverse colon, as I mentioned, is in the infracolic compartment. So we can see we've got small intestines, ascending and descending colon. If we look at the root of the mesentery, which is running in this kind of approximate direction, we can see that the infracolic compartment is actually divided into two. We can see we have a left one here and a right one here. And these two parts, the two parts of the infracolic compartment, both contain what are known as paracolic gutters. And these allow communication between the supra and the infracolic compartments. So we have these paracolic gutters that are positioned lateral to the ascending and descending colon. So if we imagine here's the transverse colon that's been removed, this is supracolic and this is infracolic down here. These paracolic gutters allow fluid to progress or to pass through the abdominal cavity. So we can see we have these paracolic gutters that allow free fluid to pass throughout the abdominal cavity. We have an important hepatorenal recess, which is the deepest part when the body is laying supine, and that's just underneath the liver and above the superior pole of the right kidney. And fluid can accumulate there when you're supine and then pass down in towards the pelvis via the paracolic gutter. So these paracolic gutters within the greater sac are important in fluid communication. And that's the peritoneum and the peritoneal cavity. We've looked at some really important definitions like visceral and parietal, retroperitoneal, intraperitoneal, and secondarily retroperitoneal. And we've looked at mesenteries like the mesentery and mesocolons. We've looked at peritoneal ligaments and omentum. And then finally, we've looked at a series of compartments, the supra and infracolic compartment.